So, working as a physiotherapist was not originally my plan. So, when I was in my undergrad, I was in a biology program, psychology, anthropology, um, and I really liked all three of those. And I was planning on going to medical school. So, I took summer school courses and I had really high grades. And I took my MCAT in third year, and I did, reasonably well. Probably not well enough to get into medical school, but okay. And I applied to medical school and did not get in. And the difference was a bunch of my friends went on and they reapplied multiple times, and they did get into medical school. So a few of them are doctors now. However, I was feeling really burnt out at the end of the 4 years, and I didn't feel like applying again. I was just sort of demotivated. Um, at the same time, I had had a couple of injuries because I used to do cross country running and things like that, and I had to go to get physiotherapy for it. So when I went to go get physiotherapy, I really enjoyed it actually. I saw the way that people were working with exercise rather than medication, and working with doctors through medication and exercise to help somebody get better. And I really enjoyed that aspect of it. Um, so keeping that in the back of my mind, I went traveling for 6 weeks and then worked for the rest of the year. And then when it came time to apply for master's programs, I sort of looked at a whole bunch of different things. I went in and I saw a career counselor for 2 sessions who really helped like narrow things down for me, and I identified a whole bunch of different avenues that I was interested in pursuing. Like I was really interested in veterinary medicine and physiotherapy and medicine and different things like that, sort of in healthcare. Um, so after that, I sort of narrowed down a few things that I was interested in. Unfortunately I didn't have the prerequisites for veterinary, so that sort of helped narrow things even more. Um, and then after that, I applied to programs that I did meet the requirements for and that I was interested in. So I ended up applying to occupational therapy and physiotherapy at the University of Toronto, at Western, and at several different schools. So I did get accepted to several different programs, and after looking at them, I was like, "Yep, U of T definitely seems like the one for me." I'm already familiar with the school because I went there for undergrad, and they're on Hospital Row, so they have access to Sick Kids Hospital, UHN Network, like some of the best hospitals in Canada. So I decided to go with them. Once you're in the master's program, they worked really hard to keep you there. I found it had a different feel than undergrad. Undergrad, everybody is trying to get the highest grades in the class, and you're kind of in competition with all of your other classmates, sort of. And then when you get into the master's program, you made it. Like you're in the program. Everybody, it felt like a tighter knit group of friends in the class. Like we would all hang out together. The teachers really worked to make sure that you were happy and that you felt comfortable in the program, and they worked really hard to keep you there. So overall, I would say that my master's experience was a little bit better than my undergrad experience just for that reason. But the physiotherapy program was excellent overall. The hospital placements were incredible, and I really grew to enjoy the physiotherapy program. Um, I had a placement at Sick Kids Hospital in the respiratory and cardiac ward, as well as on the burn unit and plastic surgery, which was sort of tough seeing the kids going through things like that, but it was also extremely rewarding. So that was a really special experience to get to have that. I was also at Providence Healthcare working with neurological patients, people who had suffered strokes, brain injuries, things like that, which I also really enjoyed. And then I had an orthopedic placement at Sunnybrook St. John's Hospital, where I worked most of the time with post-surgical people, but also sometimes with amputees and stuff like that. We also had a spinal cord injury unit in the physiotherapy program, and so we got to go to Lyndhurst Center, and it was just amazing to see people who had these injuries and were learning to walk again sometimes and live with these injuries, and it was a really amazing part of the program. So After that, COVID hit, and that was tough because we still had several placements to do in our program, and no one wanted to touch anybody else because they didn't want to get COVID, and physiotherapy is a very hands-on profession. So that was a little bit tough to finish the program. But luckily, I was placed at an orthopedic private practice clinic in Aurelia, who ended up hiring me after my double placement there finishing up. So currently, I'm working in Aurelia at this private practice clinic, and I do really enjoy it. Like the physiotherapy is a highly regulated profession, so there's a lot of paperwork, there's a lot of obligations that you have to meet to the college. But at the end of the day, it's a very rewarding profession because you feel like you're actually making this small little difference in someone's life. Like people come in and they can barely walk, and they feel like this is it, this is the end of their life. They're not going to be able to do stuff anymore. And sometimes you can get them walking again and enjoying life again and playing with their grandkids and things like that. Or post surgical injuries. People are just in so much pain, and you're able to decrease their pain and get them back to doing the things that they want to do. There's just so many opportunities to advance yourself in physiotherapy as well. Like you can take acupuncture, you can do lymphedema massage for post-cancer patients, you can do pelvic health physiotherapy, which a lot of people don't realize that physios do. You can work with children, you can work with elderly people, you can work in hospital, you can work in private practice, you can open your own clinic, and there's so many jobs available right now. So it's a really rewarding profession to get into. Um, so was I originally going for physiotherapy? No, but I feel like I've landed in the right spot, and I think other people would enjoy it too.